Okay, so I was asked to do a video blog on percussion for the abdomen, and I'm just going to be going over a few things. I'm going to go over general timpani. What you're going to do is you're going to percuss in all 4 quadrants, and you'll go ahead and do the finger striking technique in each of the 4. So you'll go ahead and percuss. I'll go over. You want to make sure that there's no dullness. If there's dullness, you will usually find dullness in a distended bladder, where there's adipose tissue, where there's fluid, or even a mass. And then you want to go ahead and percuss for the liver span, and you'll do that by determining where the midclavicular line is, and you want to go ahead and percuss where there's abdominal resonance, and you'll go ahead, it's usually around the 5th intercostal space, and you want to percuss down to where the abdominal resonance goes to a dull sound. So once you percuss, and you're going to do that by the finger tapping method, once you determine that spot, you're going to mark it, and then you want to find where abdominal tympani is, and you want to go ahead and percuss upwards towards the midclavicular line. And when you do that, you want to stop where there's dullness, and you'll have 2 markings of where the liver is. And for a normal adult, it should be between 6 to 12 centimeters. For a male, it's usually 10.5, and then for a female, so in her case, it should be around 7 centimeters. And if it's larger than that range, it could indicate an enlarged liver or hepatomegaly. So another thing you want to percuss is for splenic dullness, and you usually want the patient to be lying down for this, but you would go ahead and look at the 9th or 10th intercostal space on the mid-axillary line. So you would go down on her left side, and you want to percuss there, and you don't want to hear any dullness. If there's dullness outside of the normal range, which is around 7 centimeters, that could indicate a large spleen. And you should hear a tympani sound when you percuss there. So then if I could go ahead and have you face that way. So then another thing that you want to percuss is, when you're doing the abdomen, is the costovertebral angle tenderness, and this is to monitor the kidney area. So when you do this, you want to go to around the 12th vertebral spot, and you're going to take your whole hand, place it against that area, and instead of the finger tapping technique, you want to do a fist with your ulnar side on the hand. So when you find that 12th place, you want to go ahead and do a light tap, and I'm going to ask you, did you feel any pain?
I did not.
Okay, so you don't want to feel any pain. If there's any pain, then that can indicate any kind of kidney problems, inflammation with the kidney, or problems with the paranephrotic area. Okay, and then another test that you can do percussion for is to determine if there is ascites versus gaseous distension. So if you go ahead and come and face the front, please. And you could do this with her lying down as well. I don't have another assistant with me, but if you can just place your hand on the center of your stomach with, yes. And what I'm going to do is I'm going to place my left hand and put it on her right flank area. And then with my right hand, what I'm going to do is I'm going to do a soft strike, and I should not feel anything with my left hand. With her hand being here, this is to prevent any extra vibrations felt. So if I do feel anything with my left hand, then that can indicate ascites. But I should not feel anything. And that is one of the ways that I can determine ascites. Another way there are some other tests determining ascites in the stomach, and one way of doing that is a shifting dullness. And again, the person should be sitting or lying supine, and you should hear tympany versus dullness. And you want to go ahead and percuss on the right side of the abdomen, and you can use the finger striking technique for this one, and you want to go ahead and assess for dullness. Okay? And that concludes an extra tutorial on percussion of the abdomen. Thank you.